Hi, this is Dr. Lee from Integrative Solution for the Ankle. Today, we're going to talk about the link between your foot pain and your back pain. So, stay tuned. Before we start, please make sure you subscribe to the channel and like this video. We upload contents on a weekly basis for your foot and ankle health, and we try to give you a lot of good information that's going to be improving your foot and ankle health. So please follow us, and thank you very much in advance. As a board certified foot doctor and also as a chiropractor, I spend most of my time treating patients' foot pain, unexplainable foot pain that doesn't go away, or foot pain that just doesn't resolve easily. One thing that I have common in most of these patients is that they are suffering from some kind of low back problems or pain. So I thought I'd kind of give you an explanation why this is happening and why this is actually significant. So this is a spinal model. So this is going to be where your head and more importantly your brain will be sitting. Through here, you'll start to notice that all the nerves are coming through from the spinal cord to a lot of the body parts, rest of the organs. Through this nerve system right here, you can function, you can breathe, you can move. For our intents and purposes, you can move your foot, and then your pain and then your sensation of your foot actually comes through this area, the spinal cord. So why is this important? As you can see, your body is a one unit. As much as I like to be able to treat your foot alone, as you can see, your foot is connected to your leg, to your thigh, to your low back, your hip, and rest of your body, ultimately to your brain. So your body always functions as a one unit. So it is not really hard to believe when you are experiencing foot problem in this area for such a long time that's going to be impacting the rest of your body, like your legs, your thigh, especially on your low back and your hip area. You see, your foot functions are largely dependent on these motions right here. The motions coming from your low back and your hip and your leg area are very, very crucial for good and vital foot functions. So if you're having problem with your low back or your hip or your tailbone area, it will inevitably make your foot to be impacted. Say that you've been having a lot of low back area problems, or you've been having a lot of low back pain, and you have been limping for many months or many days. It's going to be impacting how you move your foot. Also, let's say that you've been having a herniated disc on your low back area, and this herniated discs are directly supplying a nerve to your foot function will definitely be impacted. So as you can see, your foot function are not independent of your rest of the body parts. They're all connected. So this is the reason why I'm actually able to get such a good results with a patient just by treating their spinal problems or their low back or their hip or their leg or knee problem and then solve their foot problem majorly. Because sometimes you have to look at a little more than the foot and ankle area to find the solutions for your foot and ankle problems right here. So the next question is this. You might be saying, okay, I have a foot pain that I've been suffering for such a long time, but wait, I also have discomfort or pain in my low back area. So how do I know that my low back is impacting my foot function? So I thought that I'd give you a little bit of few signs your low back might be impacting your foot function or giving you foot pain. Please understand that these are going to be general guidelines and those are going to be signs and symptoms. But in order to really find out about your individual cases, you have to talk to your doctor to make sure that you get this entire kinetic chain to be explained to you, because your body is unique to you only, which means that it's going to be different from case by cases. All right, so let's start. So number one sign that you might be having a foot pain that's coming from your low back area is if you experience shooting pain from your low back down to your foot. As you can see, there are a lot of nerves that comes from your low back all the way down to your foot. So when you're actually experiencing this shooting pain down to your foot coming from your low back area, that's exactly what you're experiencing. Through this nerve pathway, you are experiencing pain down to your foot. So this is going to be one of the really clear indicators that your low back or your hip problem might be impacting your foot pain or giving you foot problems. Another way that you can tell that your low back is impacting your foot is if your foot pain is just kind of diffuse or transient. So what does that mean? So when you are having your foot pain kind of everywhere, if I ask you to just kind of pinpoint where your foot pain is, it's really hard to do because it just kind of hurts everywhere. That tells me that there is not one specific area that might be impacted. It also could be telling me that there could be some kind of problems above your foot and ankle area that is actually impacting your foot and ankle health. So that's actually something that is going to be very, very common, at least in my clinical experiences, that low back is impacting your foot and ankle health. This is going to be an important one. If you are experiencing some kind of stiffness in your low back and then your leg and your thigh, it could be a sign that your foot pain might be coming from something above here. A lot of people think that when you are having low back pain, it has to be like pain, like a sharp pain, dull pain, achy pain. Not necessarily. Stiffness is one of the earlier signs of a low back problem developing. So when you are having stiffness in this area, in the low back area, or especially the leg or thigh area, that tells me that there are some kind of problems actually brewing over here. Those patients also feel a lot of stiffness over here connecting to their foot. So if you are having a lot of stiffness in your leg and your thigh area, it might be also a sign that something might be happening over here and that needs to be examined a little bit more closely and relate to your foot and ankle problems right here. If your foot pain is starting to develop more with movement, say if you have more foot pain at the end of the day versus the beginning of the day, that could also tell me that you might be suffering from something that is going to be above your foot and ankle area. So with more movements, you are going to irritating the nerves that are coming down from your low back area down to your foot and ankle. That could also be a trigger to make your foot pain to be worse. That tells me there could be some kind of contributing factor from your low back and your hip area down to your foot. That also tells me as a doctor that I need to look at your foot and ankle area closely. Some of you guys might be thinking, oh my God, I have all the signs that he just talked about. Or some of you guys might be like, I have most of the signs that he talked about. So is my low back really contributing to my foot? Should I also have my low back to be checked? So that's one thing that I want you to really understand. This is going to be by case, and you have to talk to your doctor and make sure that your rest of the body is not really contributing to your foot pain. So if you have been getting treated for your foot pain for the longest time, the pain is not resolving, it might be a really good indicator there's something else might be going on elsewhere that is actually impacting your foot and ankle health. It is really important that you understand the foot and ankle health, like I said, is connected to your overall health. So it is really important that you look at your foot and ankle health with holistic picture, with your whole body in picture. So this is the reason why I was able to improve most of my patients' foot and ankle problem without touching the foot. Because I'm actually addressing those other areas in the body that are crucial but often missed for good foot and ankle health. Thank you very much for watching this video here today. What I just have talked to you guys about today is something that is very close to me. That actually is my mission statement for my clinic. More often than not, I see doctors and patients alike. They're not looking at the entire body picture for your foot and ankle problems. So more often than not, I see a lot of patients getting unnecessary treatment, surgeries and medication for foot and ankle area because both patient and doctors are missing the entire picture. That there is more to be treated more than foot and ankle for your foot and ankle problems. It's very important that you understand your body is connected with chains. So your foot and ankle is connected to the rest of the body. So you also have to examine the rest of the body to treat this area holistically and properly. Thank you very much for watching this video. If you have liked this video, please press the like button and subscribe to our channel. Thank you very much. I'll see you next time. Be well.